get started. I appreciate you all taking time out to be here with me today. The talk for this month is the mind-body connection. And if you've heard me talk at all before, you know that I like to really reinforce the importance of posture and how that relates to the ability of the brain to talk to the body. So we'll cover that topic today. What I feel is really important is, you know, it seems to be that we're only going in the direction of more sitting and more phone usage and more looking down, even with all the awareness and the talk about text neck and um, it and my evidence is what I see in the clinic when new patients come in with headaches and with neck pain and their loss of curvature in their spine that indicates that they're spending a lot of time looking down. That's my evidence. But you look around at bus stops and train stations and people waiting for Ubers at the airport, they're looking straight down. Their head is like looking almost at their feet. And one expression I like is, whatever you practice, you get good at. And if it's good practice, you'll get better at being good at that thing. If it's bad practice, you'll get better at being bad at that thing. And one of my soccer coaches always said, perfect practice makes perfect, not just practice makes perfect. You have to practice the right things, right? Um, and our body is an amazing learning machine. So whatever we do repeatedly, we'll get better at it. So that's the hope. So understanding this connection, this mind-body connection, is really essential to optimizing our health and our longevity. Um, we'll talk about it more later in the talk, but um, you know, the ability of your brain to first of all communicate with all of your body parts through that spinal cord, through the main communication channel, and then out through all the nerves, the organs, is really what your spine's job is. And if your posture is upright and you have good, healthy curvature in your spine, then that pathway has the least amount of tension and the maximum amount of protection to it. The reason why your brain is encased in bone and your spinal cord is encased in bone because they're the two most vital parts of your body. And the amazing thing about the spine, though, is that it's made of 20 more movable bones versus your cranium is not as movable and is not required for us to move around. So the spine has that dual job of protecting that lifeline and allowing for those bodily functions to be coordinated by the brain. But it also has that requirement and that necessity to be movable and flexible. So we'll cover today, we'll talk about the role of posture, how it impacts the nervous system. We'll talk about good versus bad posture, the impact of posture on your mood and your mental clarity. We'll cover simple strategies for working on it. And then we'll talk about how chiropractic care can help you with posture as well as help you enhance overall health. And then we'll talk about how it has long-term benefits for aging and healthy longevity. So let's dive in. The role of posture in supporting the nervous system. Like I was saying before, the nervous system carries all electrical signals between the brain and the body. Think of that pathway, the spinal cord being like a river that should flow out through the nerves to all the organs, down your legs, down your arms, to the muscles, carrying that vital energy. We call it energy, electrical energy. You maybe have had an EKG for your heart or an EEG for your brain, or maybe a needle EMG for muscle. All of those are ways of measuring the electro signals. So EKG for your heart is electrocardio. EEG for brain is electroencephalon, which means brain, and EMG is electromyo or muscle. So all of those are measuring how well is that information transmitting through that pathway out to the vital parts of our body. And that spinal cord needs to be well protected in order to do that job. And our posture, whether it's upright and it has that opening and pathway well supported, is one version, which is the ideal version. If we're looking down, if we're looking, at our computer, looking at our phone, if we have a twisted posture, like we're crossing our legs as we're sitting or sitting as we're reading a book, um, it's okay for a few minutes, but if we do that repeatedly, that becomes our habit, then we start to shape and distort and potentially irritate and then damage that spinal cord that go through that path. And and other times people might experience an injury. Maybe they had a car accident. Maybe they got hit on the playing field. They were hit from the side when they were being tackled, what have you, or they fell on the side on the ice or something. All those are ways that our body takes little hits and little ways that it can be misshapen that add up over time and can lead to a distortion in our pathway. No one of those events might be something that you remember until, during an evaluation or a consultation in our office, we'll say, hey, well, what have you been through? What kind of injuries or falls or traumas have you had? And people think, oh, nothing major. But then you look at the spine and, well, how did it get that way? It had to happen sometime. And it doesn't have to happen in one moment. It just gradually accumulates. So that's why it's super important to look at posture from a proactive standpoint as much as possible. But now we're also going to look at what ways we can help it when there is not good posture. So it is key to maintaining posture, to maintaining the integrity of the nervous system. And integrity, one thing, one comment I will make is, the best state that we can be in is a balance between our get up and go and our rest and digest. We don't want to be too much pedal to the metal all the time. Look, if you think about your car, where you might red zone it, PMs are revving, and it's like you can tell that the car is straining. Well, we might have to do that sometimes in order to get through some kind of a urgency, but we don't want to live in that urgency all the time. It wears us out. And on the other side, if we're constantly in rest and digest mode, which is good to help us process our food, help us recover after a long day's work, we need to restore our energy, repair our body. But if we don't have that get up and go in the morning, then that's an issue as well. We need to have that balance in our nervous system of the gas pedal and the brakes. So about those two sides of the nervous system. So understanding good and poor posture. Well, good posture, if you look at it from the front, see the figure on the right, it should be vertical. We should have our head centered, symmetrical between our shoulders. Our rib cage should be balanced and centered on our pelvis, and our pelvis should be balanced and centered over our feet. Now, from the side, the middle of our ear line up with the top of our shoulder, which should line up the middle of your hip, which should line up with your ankle. So from the side, there should be a vertical line, an imaginary line, if you would. If somebody saw you without your head going forward from your shoulders or your rib cage forward, or your pelvis forward and back, your feet. Now, posture, what does it do? Beyond what I was sharing, it does support our natural spinal curves. We should have a forward curve in our neck, a backward curve in our mid back, and a forward curve in our low back. And those give our spine this resilience. It's like a shock absorber versus if the spine was straight, then it's more like a hammer on a nail. The weight of our head or the shock of every step pushes into that spine and compresses it. But with the curves, it allows that spine to absorb that shock impact of our movements. It minimizes the stress in the spine, taking the strain off of the discs, off of the joints, and off of the muscles, ligaments, other structures that hold it together. Um, Good posture encourages better nerve signal. When our spine has those proper nerves and proper alignment, then the nerves are stimulated. There's little sensors in the joints that get stimulated that light up the brain. Think about it as like an instrument panel gets lit up, like little buttons light up when there's activity. Our brain is that sensor of what is going on. But what reports what's going on are these tiny little sensors in the joints and in the muscles and in the ligaments that then communicate to the nerves and then communicate to the brain. So positioning makes a huge difference in terms of what type of information the brain is getting. And then lastly, it improve overall energy and function. Um, in terms of energy, it's much more difficult for the body to carry itself in position out of alignment, and especially with our shoulders and our rib cage forward. When we do that, we're straining the back part of our upper back and neck. There's a lot of people who report tension headaches at the base of their skull and in their upper back region, like between their shoulder blades, because of forward head position. Why? Because those muscles are not designed to work that way all the time. We have muscles in the front of our spine holding our head forward, and we have muscles in the back of our head and our upper back holding our head backwards. And they be working equally if our head is positioned in the center. If our head goes too far forward, then as I just described, the muscles that attach at the base of the skull, your upper back, will work too hard, and then they just feel strained and tired and worn all the time. They build up lactic acid. You start to feel like, yeah, I've got this tension or tension headache or different aches and pains. So what I'm trying to emphasize is that it's a lot more work to carry a misaligned asymmetrical spine versus symmetrical and aligned. Now, understanding good versus poor. So poor posture, I was saying, forward head position, it's been nicknamed neck, or you can call it slouching, or even twisting of the spine. Some people have a rotation, and it's quite astonishing to see them in an exam when I do a posture evaluation. You can see their pelvis is twisted, and then their rib cage counter twists to compensate, and then finally their head will do one more compensation to try to end up with their eyes looking straight ahead. At the end of the day, we need our eyes to look straight so that as we move forward, we are taking in the sensory information from what's in front of us. If our body's pointing that way and our eyes are pointing that way, that's a problem for our mobility. We have a lot more clumsiness and a lot more difficulty getting around. Plus, it's going to create more tension and twist in that pathway of the spine. Um, what do we detect? We look for those subtle little things. So whether it's a rotation or a tilt or a forward position or a backward shift, all those things be really an incredible variety of combinations. And you can have a, a twist and a shift at each part of the spine, which makes it quite complicated. So we try to zoom in on what the major issues are and just go kind of like peeling away layers and focus in on what's the most important thing to address. And in this case, we're talking about forward head posture as one of the primary and most common poor posture patterns. There's no shortage of people around looking down at their phone, looking down at their computers all day long. And if that's the case, then I can imagine um, they're going to have those issues I described. So it's important to, I would say, be cognizant of your position of your head, specifically relative to your rib cage. And I like to use the wall. If you set, if you stood against the wall with heels touching and your back touching the wall, and then your head touching the wall, and you can slide down and do like a modified um, squat where you do a wall sit. That is a way to feel, okay, I've got my head touching the wall, got my back touching the wall, and my bottom touching the wall. That is how you want to be positioned when sitting or when you're using your phone. If you use your phone, you want to be able to hold it up so your head doesn't have to tilt down. Um, that's an relatively easy intervention that will help make a difference right away. Now, poor posture. What else does it do? It adds pressure on the spinal joints and the disc. If we shift to the front, back, left, or right, the discs are like gel packs or like a gel ice pack. So if you put pressure on that pack, you know how that the content of that gel pack will smush and shift and morph out of its normal position. Another way of thinking of it is like an ice cream sandwich, a cookie, if we have that uneven posture and putting pressure on the disc, over time that disc will morph and shift out of its normal position. And for a short time, it can handle it, but over the long time, it will wear out. And there's 14
Mhm.
layers of the disc that need to break before that disc will herniate. So if you've ever heard of somebody who has a disc herniation, it took 14 separate rings, protective rings, to break down before that herniation happens. That's a lot of work and a lot of strain
Mhm.
over a long time. The less we can do that, the better the spine will last. Um, Next, tension on the muscles and the nerves. We kind of covered that with regard to the forward head position. And then reduced efficiency of nerve flow. It's amazing to realize that when your head shifts forward, um, we with a straight neck or forward head posture, you can reduce the speed of the brain to body communication by about 20%. So think about your reaction time slowing down by about 20%. It's it might not seem like a lot, but imagine somebody who's like an Olympian trying to shed, hundredths of a second off of their 100-meter dash, or somebody who's trying to react to, even you're driving and somebody bolts out in front of you and you have to stop quickly. 20% is quite a lot. So if you have a straight neck, if you have forward head, that puts a lot of dampening pressure on the quality of communication between your brain and your body, and which could be your muscles, it could be your organs, it could be anything. And then kind of logically based off what we're describing, if you're shifted out of alignment, if you have uneven strain on those joints, on those discs, you're more vulnerable. You're more vulnerable to injury. Like if you go to the gym and you like to lift weights and you like to load up the barbell and put maybe do squats. Well, it's really important to realize how symmetrical and how aligned is your spine. And it doesn't have to be that you do heavy lifting. It could be that I just want to do a workout and my body weight is off center when I do that workout. And if I do that for too long, it's easy to think of how that will eventually lead to wear and tear and injury. And especially when you're around the house and you're to pick up something suddenly. I need to pick up this bag of mulch, or I need to pick up the laundry, or I need to carry the groceries in. And maybe you do it in a little twisted fashion and your spine's already a little twisted. And oh, I hurt my back. Well, why did that happen? And sometimes it seems kind of random, like, well, how did they hurt themselves just doing that silly little move? Well, if your spine is already in that compromised position, then does it make sense how that would lead you to be more vulnerable to that instance, um, causing an injury? So now what about the tie-in with mood and mental clarity? Like, how does that happen? Well, most people think of the spine is not well, that it just relates to, back pain, and that's kind of the end of the story. But as you've listened so far, obviously the spine has a lot more to do with overall body function. Then what about the other way? What about going up to the brain, posture relating to brain health and brain function and our moods? So there is evidence that posture and mood are deeply interconnected. So when you see somebody with poor posture, you would almost assume you see them kind of slouching, slumping. Um, you almost imagine they're in a bad mood. You almost imagine that they have low self-esteem, or they have low energy, or they're just tired. Or they just look it, right? And sometimes it can come from up here. It can come from your state, your mood, and be translated and shown by the body. But I will share with you that if you sit at a computer in a great mood and you do that for a long time, you look at your phone, you're in a great mood, and you do that over and over again, and you eventually shape your posture, shape your body into that forward head position, then as you become more used to that and that becomes your normal, it actually does feed back into the brain to contribute to a bad mood. It can contribute to brain fog, lack of focus, lack of concentration, partly because when we don't have good posture, that leads to poor signaling and stimulation of the brain from normal movement. because in poor posture, we don't get all those little vertebrae moving the way they're supposed to. And when they're not moving the way they're supposed to, the instrument panel doesn't light up. And then the brain starts to get shut down. It shifts into fight or flight. And when we're in fight or flight, we're more irritable. We don't value concentration when we're in fight or flight. We value instinctive reaction. We want to be quick to respond to a threat, not slow and contemplative and focusing and thinking about the long-term implications of our actions. It's right now. So the longer we're in stress mode, the more brain shifts out of focus and concentration. We shift out of those good feelings of happiness and fulfillment, and we shift out into irritability and anxiety. Eventually, if that persists, we can lead to depression because it literally shifts our whole body chemistry. Just our emotions, like I was saying, can affect how you carry yourself. The reverse is true. So how you carry yourself can affect your emotional state. And I love this little figure, this guy here. He was walking really tall. Some of the things, what else can poor posture affect? So we mentioned the low energy. We talked about brain fog. It can also, as we shift into more fight or flight, we can see our immune system and our digestive system start to get shut down in favor of immediate need. Muscles need the blood when you're in fight or flight, not your digestive system or immune system. If you stay in chronic fight or flight, then they get suppressed. Um, Difficulty sleeping, again, because we're agitated, we're on edge, we're anxious, we're worried, we're thinking about what's to come next. And if our body is sending those signals to our brain, regardless of how good things are, body is actually telling our brain, hey, things are not good. Your life might be good on the outside, but on the inside, your body's saying, hey, we're not in a good place. And so your brain starts to basically take those signals as the current state of affairs. And then, like I said, mood swings, you can get moody, anxious, and irritable, and even can develop headaches or neck pain or other types of pain. So what are some things you can do at home? We want to work on our posture. We have to work on really undoing some of the things that we do with modern lifestyle. And this isn't so much of an undoing correction that we would do in the chiropractic office, but things you can do at home to train yourself to maintain. So the first one is a wall angel. So if you stand against the wall, heels touching, butt touching, shoulder blades touching, and your head touching, and then go up into this goalpost, sometimes call it stick 'em up position, where your forearms are touching the wall all at the same time with your head, shoulder blades, butt, and heels. And what you'll find are you might have certain areas that are restricted, certain areas have a difficulty touching the wall, and take note of that. Don't force it, but just try to gently press the arms against the wall and feel the stretch. If you do it with ease, then you're in good shape. Most people, though, have difficulty with one or the other. Either they can't get their head all the way back, can't get their arms all the way back, or both. So this is something to do at home. Step two is to employ gravity as your assistant. Lie on your back and do the same thing and lie on the back for 5 to 10 minutes. You can rest, you can do some meditation, you can do anything that you feel calming, maybe some deep breathing exercises. Now you'd have gravity pulling you down, gravity pulling your arms back. What you'll still find are those areas that are tense. They will really light up. Instead of you doing it actively, where you're contracting the muscles to push against the wall, now you just have gravity pulling you down to the floor. For some people, their stiffness in their neck will be prohibitive and they won't be able to go all the way. If you have the ability to feel stiff and you can hold that, then just try to count 20, count to 30, and then take a little break, go, and then go back again. Go through cycles of that 5 to 10 minutes. And then lastly, if you work on some of your core, some basic exercises that you may already know are like plank. You can Do a plank on your forearms with your toes touching the floor and your body like in this figure here in a straight line. Or you can do a plank where your knees are the contact and you have a straight line from your knees all the way to your back to your head, and you're holding your body on your forearms. The goal there is to basically engage that middle section between your rib cage and your pelvis, which is known as the core, but your core is truly your spine. And that region between your rib cage and your pelvis, there's no ribs there. It's basically just the spine holding things together, and then the muscles around the spine, which is what this core exercise would train. And then when you're walking, take that feeling you got from the core exercises, take that engagement when you're firing those core muscles, and try to keep your core somewhat toned, keep it engaged, especially when you're going to lift something. If you're going to squat down, keep your core engaged. It'll hold some tension and protection around that region of your low back, which is super important. Now, the other part I want you to think about how you hold your head when you're moving around. If you hold your head too far forward, if you hold your head to the side when you're driving, some people like to drive, they lean off to the side. And I look at their x-ray and I wonder, well, how did you get there? Do you ever drive that? Or do you sit on the couch or do you sit, at your desk leaning on the side all day long? Um, because these are patterns that you might not even be aware of that you do. Uh, Try to pay attention to how you hold yourself and practice that central position when you're sitting, standing, walking, and some of these exercises can help you do that. Chiropractic care, this is what I do. So obviously, I'm going to emphasize the importance of chiropractic care because if we have areas that are stuck in the spine, these are two bones in the spine. They should be freely moving, and we have 24 of them. They all should move their full range of motion every day, front, back, side, and rotation both ways. If they're stuck because of a prior injury or because they've been held stuck and immobile too long, then they start to adhere to each other, become restricted. They need to be released. They need to be released into alignment, not just cracked, not just popped, not just moved away. Because if these are the vertebrae and they're kinked this way, what are they doing to the spinal cord? They're pinching it. They're pinching a nerve over here. They're pinching the spinal cord in the middle, or at least stretching it or putting tension on it. None of which is good. It needs to be aligned this way. So if you just cracked it, like, oh, I want my back cracked. Well, chiropractic care is a significant upgrade to just cracking your back. Why? Because we find out where is this happening and we help it be here. And then we zoom out and we look at the overall curvature and overall alignment and strength and flexibility of your spine and restore as much of that curvature, strength, and flexibility on top of those individual vertebrae getting aligned because it truly is one big system from the bottom. And that system needs to be able to maintain protection for the spinal cord and all the messages between the brain and the organs and the muscles. And so what to do? So if we do a personalized corrected plan, one size fits all, it's to correct the individual spinal misalignments and their curvature to strengthen the postural muscles that support that correction. And as a result of that, we get restored nervous system balance and function. The brain starts to get the information that it's looking for. It gets stimulated when the vertebrae are moving their normal amount. And when those curves are restored, proper function and dynamic biomechanics of flying that you can take with you when you go and move your body, whether it's a workout, whether it's walking, whether it's lifting, doing the daily chores, what have you. The key is that you have a healthy spinal structure that center of all your movement. And the nervous system is the center of all of our experience. We live our lives through our nervous. If the nervous system is stuck in fight or flight, our whole experience of life will be stuck in fight or flight. Think of somebody who's stressed out all the time, or somebody who's in an abusive relationship, or is just worried or not well all the time, their body's shifted into that mode. If we can get that person shifted out of that stress and fight state and into a more of a healthy, balanced, free from interference state, then they can experience life just as it is, not shifted or not skewed towards I'm worried, I'm irritable, I'm anxious, I'm even depressed, I'm unfocused, I can't focus on anything because I'm so internally consumed by what's happening in my health. We need to eliminate that state and allow it to be there for crisis only, and then get into more of a healthy, balanced state so our body can do what it's meant to be doing, which is just letting you live and fulfill your purpose in life. So, improving posture is a lifelong investment in your health. Why do I say that? Because most people, honestly, we're not taught to a lifelong investment in our health and our on our healthcare culture. Our healthcare culture is really about being reactive. It's about waiting until we're sick. In my office, I see a lot of people waiting until their neck or their back hurts. And they say, "Oh, I haven't needed a chiropractor yet. Thank God I haven't needed one." And I say, "Well, have you needed a dentist yet?" And they say, "Well, no, I go for my preventative checkups and I brush my teeth every day." Okay, well, you take that strategy for your teeth, but I take that strategy for your spine. Your spine will be essential to you aging. You're trying to move and keep your body active, participating in all of life's wonderful opportunities. And, it'd be great to have your teeth too. But I do think that if we can help people understand the value of spinal hygiene and a preventative, proactive spinal care routine, it will serve them great as an investment, little bit by little bit along the way, rather than trying to play catch up. It's kind of like saying, I'm going to brush my teeth and go to the dentist once my teeth hurt or my teeth look bad or they start to look brown and decayed. The dentist is going to say, well, where were you like 20 years ago? We've got a lot of work to do. I might have to pull teeth. I might have to replace them. I'm going to do a lot of cavities today, and it's not going to be pretty. Well, in our office, we're still proactive. We're still non-invasive. We know administer medication, but we still do a lot of urgent care for people who are coming in, significant backlog of spinal needs. And our hope is to help people turn it before they need surgery and before they get exposed to addictive painkillers and those kind of things that can be, very dangerous and life altering. Um, Ideally, we're just all taking care of our spine like we do our teeth. It's amazing how well people have how to take care of their teeth proactively before they get in cavities. So if you took that approach to your spine, I think you'll be in great shape. If you need some catch-up work, we can do that too. But the important thing is start out, do your homework, do your posture exercises that we talked about, and start paying attention to how you carry yourself all day long. So optimize your health today. Take these exercises, take these strategies, and employ them. I hope they're valuable. If you know somebody in your life who could use a consultation and an evaluation of their spine and their posture, please don't hesitate. Send them our way. We'd be happy to serve them. I'm happy to open it up for any questions right now. If anybody would like to ask a question, I'll stay on for a couple more minutes.
You were very thorough.
Wonderful. Well, it's an honor to be here with you. I really appreciate you spending part of your day with me. I love teaching, and I hope you got some good learning out of it, and maybe a couple of things you can apply in your day today. Make sure you smile. Make sure you breathe while you're doing these exercises too. I didn't talk about that. So make sure you incorporate a relaxed, calm state while you're doing these things. And I look forward to seeing you at our next talk. Have a great day, everybody.